Which of the following additives is found in the gray top tube used for glucose testing? A. Heparin. B. Sodium citrate. C. EDTA. D. Potassium oxalate and sodium fluoride. Answer: D. The gray top tube contains potassium oxalate as an anticoagulant and sodium fluoride to preserve glucose levels. This combination prevents glycolysis, ensuring accurate glucose measurements. A patient is on anticoagulant therapy. Which test would most likely be monitored? A. Lipid panel. B. Hemoglobin A1C. C. Prothrombin time, PT/INR. D. Thyroid function test. Answer: C. PT/INR is used to monitor patients on warfarin or other anticoagulants. It assesses how long it takes for blood to clot and helps determine if the therapy is effective and safe. Which of the following sites should be avoided during a routine venipuncture? A. Median cubital vein. B. Vein adjacent to a hematoma. C. Vein in the antecubital fossa. D. Vein visible and palpated on the forearm. Answer: B. A site near or over a hematoma may yield hemolyzed or contaminated blood and can cause additional discomfort or injury to the patient. Always avoid compromised areas. Which of the following conditions would require airborne precautions during specimen collection? A. Hepatitis C. B. MRSA. C. Tuberculosis. D. Clostridium difficile. Answer: C. Tuberculosis, TB, spreads through airborne droplets. Airborne precautions, including N95 masks and negative pressure rooms, are essential for preventing its transmission. Hemoconcentration during a venipuncture can be caused by A. Using a small needle. B. Leaving the tourniquet on too long. C. Drawing blood without gloves. D. Drawing from the wrist. Answer: B. Prolonged tourniquet application over 1 minute causes hemoconcentration, leading to falsely elevated blood analyte levels due to water loss from the blood. Which of the following errors is most likely if a lavender top tube is not filled to the proper volume? A. Blood culture contamination. B. Clotting of the specimen. C. Hemolysis. D. Dilutional error leading to falsely low hematocrit. Answer: D. Underfilling a lavender top tube alters the blood-to-additive ratio, especially the EDTA, which can falsely lower hematocrit and other cell counts. Which part of the needle is designed to reduce pain and improve blood flow during venipuncture? A. Hub. B. Bevel. C. Shaft. D. Lumen. Answer: B. The bevel is the slanted tip of the needle that eases skin entry and allows smooth blood flow. A properly positioned bevel reduces trauma and improves success. The primary purpose of inversion of tubes after blood collection is to A. Speed up clot formation. B. Mix blood with additives to prevent clotting or ensure reaction. C. Avoid contamination. D. Eliminate bubbles. Answer: B. Inversion ensures thorough mixing of the blood with additives, e.g., EDTA, citrate, preventing clotting or allowing proper reactions depending on the test. When collecting blood for a lactic acid test, the sample must be A. Heated immediately. B. Collected in a lavender top tube. C. Protected from light. D. Transported on ice. Answer: D. Lactic acid levels can quickly rise if the sample isn't chilled. To ensure accuracy, the tube is placed on ice and delivered promptly to the lab. During capillary collection, which of the following is a critical step to avoid contamination with interstitial fluid? A. Squeezing the finger tightly. B. Warming the site beforehand. C. Using a lancet larger than 3 mm. D. Collecting blood from the pinky finger. Answer: B. Warming the site increases blood flow and reduces the need to squeeze, which can introduce interstitial fluid and dilute the sample, compromising results. A phlebotomist must identify an unconscious hospital patient. Which method is acceptable? A. Ask the family member present. B. Check the chart outside the door. C. Match the wristband to the requisition. D. Ask the nurse for the patient's name. Answer: C. Proper patient ID involves matching the wristband with the test requisition. This ensures patient safety and prevents specimen mislabeling. Which vein is most commonly used for venipuncture in adults? A. Cephalic vein. B. Basilic vein. C. Median cubital vein. D. Dorsal metacarpal vein. Answer: C. The median cubital vein is centrally located, large, and stable, making it the most reliable and preferred site for venipuncture. Which of the following specimens must be protected from light immediately after collection? A. Creatinine. B. Vitamin B12. C. Bilirubin. D. Electrolytes. Answer: C. Bilirubin breaks down when exposed to light, resulting in falsely low readings. Wrapping the tube in foil or using amber-colored tubes is required. Which of the following complications is most likely if a phlebotomist punctures an artery instead of a vein? A. Hemolysis. B. Petechiae. C. Hematoma and pulsating blood flow. D. Clotting in the syringe. Answer: C. Arterial puncture can cause bright red, pulsating blood flow and significant hematoma formation. Immediate pressure must be applied for at least 5 minutes to prevent further complications. What is the maximum depth recommended for a heel stick on a newborn? A. 1 mm. B. 1.5 mm. C. 2.0 mm. D. 2.4 mm. Answer: C. The maximum safe depth for a heel puncture is 2.0 mm to prevent injury to the bone. Going deeper risks osteomyelitis and other severe complications. What is the primary function of EDTA in a blood collection tube? A. Preserve glucose. B. Inhibit clotting by binding calcium. C. Promote clotting. D. Separate plasma from cells. Answer: B. EDTA acts by chelating calcium, a necessary component in the coagulation cascade, thereby preventing clotting and allowing for hematological studies. A phlebotomist notices that a patient has an 4 in the left arm. What is the best site to collect a blood sample? A. Above the 4 site. B. From the same 4 line. C. From the right arm opposite the 4. D. From the left wrist. Answer: C. Blood should be drawn from the opposite arm to avoid dilution or contamination with 4 fluids. If necessary, collection should be done below the 4 with precautions. The lavender top tube is most commonly used for which of the following tests? A. Point/INR. B. Complete blood count, CBC. C. Glucose tolerance test. D. Serum chemistry. Answer: B. Lavender tubes contain EDTA and are ideal for preserving the shape of cells, making them the standard for hematology tests like the CBC. Which of the following conditions is characterized by excessive bleeding due to a deficiency of clotting factors? A. Leukocytosis. B. Hemophilia. C. Polycythemia. D. Anemia. Answer: B. Hemophilia is a genetic disorder where blood lacks essential clotting factors, leading to prolonged bleeding even from minor injuries. Which of the following best defines hemolysis? A. Clot formation in the specimen. B. Breakdown of red blood cells releasing hemoglobin. C. Separation of plasma from cells. D. Infection of the blood specimen. Answer: B. Hemolysis refers to the rupture of red blood cells, which can interfere with lab results, particularly in potassium, LDH, and bilirubin testing. What is the consequence of not allowing alcohol to dry before venipuncture? A. Patient satisfaction increases. B. Results are more accurate. C. Hemolysis or burning sensation. D. Easier vein location. Answer: C. Inserting a needle through wet alcohol can cause a burning sensation and increase the chance of hemolysis or sample contamination. The bevel of the needle should face which direction during venipuncture? A. Up. B. Down. C. Sideways. D. Toward the tourniquet. Answer: A. The bevel should always face up for a smooth entry into the skin and vein, minimizing discomfort and ensuring proper blood flow. Which of the following should be done if a blood sample is accidentally collected from the wrong patient? A. Relabel the sample with the correct name. B. Discard the specimen and redraw using proper ID. C. Notify the lab but send the sample. D. Correct it on the requisition form. Answer: B. Patient safety and sample integrity are critical. Mislabeling is a serious error. The specimen must be discarded and recollected using correct patient identification. In blood culture collection, what is the most important step to reduce contamination? A. Using a large gauge needle. B. Applying a tight tourniquet. C. Proper skin antisepsis with chlorhexidine. D. Drawing the blue top tube first. Answer: C. Skin must be thoroughly cleaned to eliminate bacteria and reduce the chance of contaminating the blood culture, leading to false positives. When using a butterfly needle, which tube should be filled first to prevent underfilling? A. Lavender. B. Light blue. C. Gray. D. Green. Answer: B. The light blue tube for coagulation tests must be filled completely for accurate results. When using a butterfly, a waste tube may be needed to ensure proper volume.